Hello, everyone, and welcome to Voices, a library lecture series. We'd like to begin with an acknowledgement that we are gathered on the sacred homelands of the Mahakiniak or Mohican people who are the stewards of this land. Today, the community resides in Wisconsin and is known as the Stockbridge-Munsee Mohican Nation. We pay honor and respect to their ancestors past and present. Voices presents speakers on timely and enduring issues each semester to broaden and enrich the scope of studies at Hudson Valley Community College. Please fill out a survey at the link on our first slide. These help to inform our future programming. Today, Voices presents Dorcey Applyrs. Dorcey currently serves as the Chief City Auditor for the City of Albany. She is a former City Council member for the First Ward of Albany. Dorcey received her master's degree and doctorate in public health from the University at Albany School of Public Health. Please welcome Dorcey Applyrs.
Good morning. As mentioned, my name is Dr. Dorcey Applyrs, and it is such an honor to be with you today. I would like to first start by thanking the Hudson Valley Community College for this wonderful opportunity to participate in the Voices lecture series. I am humbled at the opportunity to kick off the series, and especially for this annual Dr. Martin Luther King Jr. presentation. I also want to start by acknowledging all of my colleagues on the front lines in the field of public health who are working to fight two pandemics, COVID-19 as well as the epidemic to address racial injustice in the United States of America. And so while many of us have spent our career training for such a time, I would be remiss if I did not acknowledge those colleagues on the front lines who are responding to this moment. So my presentation today will be on the politics of public health. So just to give you an idea of the direction that the presentation will take, I'll start talking about my own personal journey throughout my career as a public health professional. I'll then define and attempt to deconstruct the field of public health, and then connect public health and politics. So, my personal public health career journey. When I think about my journey, I often think about a moment in time when I was sitting in a very cramped room at one of the annual Public Health Association meetings that was being convened in Washington, D.C. And I was in a cramped room, and of course this was pre-COVID, in this cramped room with bright-eyed young professionals in the field of public health, primarily colleagues of color. And we were all in that room to learn about health disparities and the role that we could all play as future public health leaders to address health disparities. And the speaker said something that was very profound to me that I will never forget. And the speaker said, when you graduate, and you start interviewing for positions in the field of public health, they will ask you, how many years of experience do you have in the field? And what he told us to really think about and to reply with is that for many of us born in urban centers, born as people of color, we were born in the field. And so what that essentially means is that we have a unique opportunity as individuals who are studying in the field of public health to marry our skills and expertise in the field, but also to marry our lived experience. So again, that stuck with me. So let me take you back to where I grew up. I grew up in Washington, D.C. And at the time, growing up in Washington, D.C., in the 80s, we were dealing with our own set of epidemics. We were dealing with an epidemic focused on people using crack and cocaine. We were dealing with violence as an epidemic. We were also dealing with the fact that there were people using heroin in our community. So at one time in this community, we were dealing with 3 different epidemics. And so I learned early on, as a young person, that one's environment strongly influences their health. Again, I learned early on the connection between one's environment and their health. I had individuals who died of HIV and contracted the virus from sharing needles. And so this is one of the seeds that was planted early on for me to want to get into the field of public health, because I wanted to help my community, and I also wanted to help other communities who were struggling with the implications of HIV. Fast forward, I attend Delaware State University. I learn about the Minority Access to Research Careers program, and it was through that program I was exposed to public health fellowships every summer. And for someone who didn't have the opportunity to travel a lot, this allowed me to live outside of my community every summer and learn about public health. And so I had the opportunity to work at prestigious institutions such as Harvard University, the University of Michigan, Johns Hopkins, and even the CDC in Atlanta, Georgia. I was sold on the field of public health and was excited when I was offered the opportunity to come to Albany to attend the University at Albany School of Public Health, where I completed my master's and doctorate in public health, and then later started working in the field. So, what is public health? Public health is a very abstract field. And what makes the field so very abstract is the fact that it encompasses multiple disciplines. So I'm going to talk about those disciplines in a moment, but for me, as someone who entered this arena, it was very difficult to wrap my head around not just the concept of public health, but also the role that I could and should play in the field. So I'm going to talk more about public health as a field and what we do in this as part of this field. So what is public health? Public health is the fulfillment of a society's interest and obligation in assuring the conditions in which people can be healthy. And I thought it was important to add obligation, because as a society, it is our responsibility to make sure that everyone is entitled to healthy communities. In addition, public health consists of organized community efforts aimed at the prevention of disease and the promotion of health. I want to highlight 3 definitions provided by institutions well known in the field of public health, all attempting to define the field and contextualize it. So according to the CDC Foundation, public health is the science of protecting and improving the health of people and their communities. According to the American Public Health Association, public health promotes and protects the health of people and the communities where they live, learn, work, and play. I just want to acknowledge that there has been a shift in the field over the years to not just focus on the population itself, but to focus on the environment, the lived environment, where people not only live, work, and play. And so, as I'll talk about in a moment, that built environment is equally important when thinking about how we address the whole health of communities. And then lastly, the World Health Organization thinks about public health as referring to all organized measures to prevent disease, promote health, and prolong life among the population as a whole. Its activities aim to provide conditions in which people can be healthy and focus on entire populations, not just individual patients or diseases. Oftentimes, people confuse the field of public health with medical care. And so what I will attempt to do is to help you understand the distinction between the two. So, when thinking about public health, we provide a focus on populations versus medicine, which primarily focuses on an individual. So two complete different focus areas. One is the population for public health, the other is the individual. Public health provides an emphasis on prevention and health promotion. In the field of medicine, the emphasis is on diagnosis and treatment. And so, as public health professionals, we think to go upstream. So instead of focusing on the illness at hand, we think holistically. How can we prevent people from getting sick in the first place? That's a key distinction between the two fields. The other is that public health as a paradigm employs the spectrum of interventions, and not just focused on the individual as mentioned, but we look at the environment as well as people's behavior. As the field of medicine goes, that paradigm places a predominant emphasis on medical care and treatment. Again, thinking about those differences, public health thinks holistically and employs interventions that not only think about addressing the illness via treatment, but we also think about how we can address the whole environment for community. Lastly, a key distinction, public health is not for some, a very clear field. And so we have multiple professional identities within our field and a variety of images. So people may work at a county health department, they may work at the CDC, they may work at the U.S. Department of Health and Human Services, or even a nonprofit organization. Whereas the field of medicine, often it is a well-established and recognized profession. And so one says very clearly, I want to be a medical doctor or a nurse, and very clearly think about a hospital setting or an urgent care setting in which they would work. So those are the distinctions between public health and the field of medicine. As a field, and you'll hear me talk a lot about the 3 Ps of public health. Our core values as a field is focused on preventing disease, promoting health, and protecting communities. So how do we do that? One of the first things that we do is define the health problem. In order to address a problem, you have to first understand what the problem is and the magnitude of that problem. And so I talked about my upbringing, and I talked about growing up in Washington, D.C. in the 80s. And at that time, there were multiple health problems. But one of the health problems that really needed to be addressed was HIV and AIDS. That was the health problem. We also, after we identify the problem, we seek to identify the risk associated with that problem. Because in order to address the problem, you have to understand what caused it in the first place. We then develop and test community-level interventions to control or prevent the cause of the problem. So in the example of HIV, there have been tests on PrEP, pre-exposure prophylaxis, so medication that people can take before having sex that would prevent them from contracting the virus. We also, in this field, have tested different interventions focused on behavioral change, like ensuring that people wear condoms, and so what types of thoughts need to go into, what types of barriers prevent people from wearing condoms, and how do we address those barriers, and implementing interventions that seek to remove the barriers so that people can wear condoms and be safe. So in addition to testing those interventions, we implement them to improve the health of the community or population. And then lastly, we monitor interventions to assess their effectiveness. So it's not enough to define the problem, identify risk associated with the problem, or develop and implement interventions. It's always important to then go back and evaluate the effectiveness of those interventions to ensure that they are working and ultimately improving the health outcomes for the communities and populations we serve. Some of the specialties in the field of public health include biostatistics and informatics. And simply, biostatistics, although not my most favorite subject when I was in school, but biostatistics really falls under the statistics umbrella and really deals with the compiling and analysis of data as it relates to a biomedical issue. We also, in the field, focus on environmental health. So we have individuals who work specifically in environmental health, working to improve the environment for communities, so that could be air quality and water quality, maternal and child health, global health. We have individuals who work across continents looking at various public health issues, minority health and health disparities, which is an area of interest for me and an area that I've worked on quite a bit throughout my career, social and behavioral sciences, health policy and management, and epidemiology. I'll spend a few moments talking about the field of epidemiology because it's not one that people often identify with or even understand what epidemiologists do. So epidemiology is the study of epidemics, and we've heard a lot recently about pandemics. So an epidemic is really an overconcentration of a disease in a community. And it is over what's normally expected for a particular disease. A pandemic consists of an epidemic that has spread across continents and countries. So in this case, as we think about the moment in time that we're in with COVID-19, it is a pandemic. And what we suspect is that it started as an epidemic in China. And the fact that it has spread across the globe implies that it is, in fact, a pandemic. Epidemiology focuses on human populations, usually starting with an outbreak of disease in a community, aims to control the spread of infectious diseases, and seeks causes of chronic disease and ways to limit harmful exposure. So the visual here just acknowledges that pathology. You have an exposure. At the end of that is a health outcome. But in between, what epidemiologists are trying to understand is the correlation, what's related, what relates the exposure to the health outcome, or causation, what explicitly caused the health outcome, which exposure explicitly caused that health outcome. So the application of that, let's talk about the story of the Broad Street pump. So what we have here is a map of cholera cases in Soho, London, way back in 1854. And so you'll see the concentrated area with darker spots. And those darker spots represent cases of cholera in Soho, London at this time. So let me paint the picture for you. It's 1854. This is a very cramped community in London. People are literally living on top of each other. There are lots of animals in this community. People don't know how to properly dispose of their trash, and so the streets are dirty. There's trash everywhere. And what happens is this outbreak of cholera in this community. And so doctors and scientists believe that this outbreak is caused by miasma. And that essentially means dirty air. There is an hypothesis that people are getting sick from breathing in the air. And so an accomplished physician by the name of John Snow, who is known as the godfather of epidemiology, he had a different hypothesis. And so he began mapping the outbreak. He said, I don't really think it's the air that we're breathing. There has to be something more to this. And so he started carefully mapping the cases in this particular neighborhood, the cases of cholera. And he discovers that they all have a common connection. They were all drinking from water from the local Broad Street pump. That was the commonality in all of the cases. And so John Snow tests his theory by simply removing the handle from the pump. And he ended the cholera outbreak. And there we have it, the early foundation for the field of epidemiology, which lays the foundation for important public health work that we do today. So now I'm going to shift to talk about public health in the context of politics. And I thought that this quote and slide were appropriate to set the table for this conversation. The quote, "Culture eats policy for breakfast," was adapted from a common quote that is used when looking at how organizations perform. And that quote is, "Culture eats strategy for breakfast." What that implies is, as a company, no matter what you do to improve your bottom line, your outcomes, you can come up with strategies and policies all you want. But if you don't address the culture, and the culture is, the tone of the culture is set by leadership, then all of that is for naught. Because culture trumps, no pun intended, strategy. And so that concept has been applied to the notion that culture eats policy for breakfast. No matter how well-intended our policies are in this country, within organizations, if we don't take a careful look at our culture, then again, it's all for naught. So let's talk about the culture of the United States, and especially in the moment that we're in right now. We have a culture that was, the foundation of that was built on white supremacy and racism. That is ingrained in the culture of the United States of America. And so when we think about policies such as the Civil Rights Act of 1964, or the Voter Rights Act of 1965, or even the Affordable Care Act, these are all well-intended policies to fundamentally change how we care and treat for populations across our country, in particular people of color. Even though we have those well-intended policies, the fact that we have a culture and individuals who subscribe to this culture of white supremacy, racism, and even capitalism, we have a very difficult time enforcing these policies and really allowing those policies to live up to their true intention. And so as we think about public health and the politics of public health, I want to make the point that the individuals who showed up at the Capitol, those individuals returned to their communities. So this gentleman who's waving the Confederate flag in the Capitol, he and others returned to their communities. They returned to their communities as police officers, professors, the heads of companies who make decisions about who gets hired, who doesn't, doctors who are responsible for treating diverse patients. And so this culture of white supremacy and racism permeates throughout our society. And so when people ask the question, why do we still have poor health outcomes for people of color? Why do we still have large health disparities? We cannot attempt to address the issue of health disparities if we can't be honest about the culture of racism, systemic racism, institutional racism, and white supremacy in our country. So politics and health. Political decisions influence our social and environmental conditions. Those include transportation, education, jobs, access to food and health care, public safety, air and water quality. I've met so many people who say, politics, I wouldn't dare get involved. It's not for me. I don't like playing games. And what I like to share with those individuals is that whether you get involved with politics or not, politics influence everything about your community and what you have access to. And for example, as I mentioned, education. The types of schools that you go to or that you send your children to, those are influenced by politics and policy. Whether you have fresh fruits and vegetables in your community, that decision is influenced by politics and policy. Whether you have access to clean air and water to drink is influenced by politics and policy. And so whether we want to get involved in politics or not, the reality is they influence every aspect of our lives. What I also like to tell people is that politics and public health is a contact sport. I, like many people, aspired to become a public health professional because I just wanted to help people. Fundamentally, that is my goal and passion in life, is to help other people. But what I've learned is that in order to help other people, you have to be willing to roll up your sleeves and get your hands dirty. People don't do the right thing just because it's the right thing to do. Oftentimes, decision makers have to be forced to do the right thing. I've also talked to people about the fact that their zip code is one of the strongest predictors of your health outcome. If you tell me your zip code, I can do research to look at your life expectancy and paint a picture of your overall health based on simply where you live. Where you live matters. I also talk to people about the fact that public health and the public's health is not always a priority of decision makers. Decision makers, especially in government, are often dealing with competing priorities. Economics, for one. And so health issues get pushed to the bottom of that list of priorities unless we have people who are willing to roll up their sleeves and ensure that decision makers understand that the public's health is a priority. And that deals with the politics of public health. So, I'm going to highlight a few images that depict this notion of the politics of public health. Black Lives Matter, racism kills. In the wake of the murder of George Floyd, we have experienced a watershed moment in our nation. And people from the CEOs of Fortune 500 companies to grassroots mom and pop nonprofit organizations are all trying to figure out how do we advance an agenda of racial justice and help to bring to fruition Dr. Martin Luther King Jr.'s dream. And so while many of us are fighting to advance an agenda of racial justice, we can't ignore the culture, as I talked about earlier, in this country of white supremacy and racism, and how those factors, that culture, impact Black Lives Matter as a movement. This movement was born out of pushing back against the culture in this country. And so while many of us think it's the right thing to do to make sure we have police reform, to make sure that everyone feels safe in their community, we are still up against a culture that's counter to that. And in order to really bring about change as it relates to police reform, we have to deconstruct the culture of this country and some of the ideologies that have been born out of that so that Black lives truly matter. This image of a little girl holding a sign, rub-a-dub-dub, the people of Flint were poisoned in their tub. We all heard about the water crisis in Flint, Michigan. And you didn't have to be a public health professional to wonder, how could this happen? Who fell asleep behind the wheel? And what we learned as this issue unfolded was that there were decision makers, elected officials who knew exactly what was going on. But because of politics and because of economics, no one addressed the issue. And unfortunately, there are children and families dealing with the fallout of poor decision making on the part of those who were trusted by the community to advocate and protect their health and safety. Again, the politics of public health, the right thing to do was to address the water issue before it became a crisis. But the politics of the day prevented decision makers from doing the right thing at that time. This image is President Bush on a bullhorn. This is ground zero, post 9/11. You see all of the first responders, the firefighters who showed up to assist with the cleanup. So to talk a little bit about the politics of this moment, President Bush and others were told that because of all of the debris found at ground zero, that there was air particulates that were potentially cancerous and could cause all types of adverse health outcomes. Keep in mind, the Twin Towers that fell included office furniture, paint, supplies that made up the buildings. And so when they caught fire, all of these materials burned, and the particulate matter from these materials lay over ground zero and covered ground zero, not just in the debris that President Bush is standing on, but in the air. And so he was warned and others were warned, when you show up, wear a mask. Because we are still learning about the unintended consequences, the health consequences of being exposed to the air at ground zero. Well, unfortunately, many responders, many firefighters are fighting for their lives. Many have lost their lives because they responded to this crisis and were not properly protected. And so many have been diagnosed with cancer. Many have been diagnosed with lung cancer and other respiratory issues, and we've lost many because of not taking the proper public health steps. So this gentleman has become very famous in the wake of the COVID-19 pandemic. And I read this caption from BBC News. U.S. infectious disease chief Dr. Anthony Fauci is being targeted by the Trump administration as tensions rise between the health experts and the president. And so it was no secret that Dr. Fauci, as a public health expert, was responding to this moment and providing evidence-based guidance on how, as a nation, we should address the COVID-19 pandemic and how we should protect U.S. citizens. Again, the politics of public health. And while Dr. Fauci was responding based on his public health expertise, that was often met with other messaging. And so what we have seen play out in this country is two very different views about properly preventing the spread of COVID-19. And while public health experts were saying properly socially distance, wear masks, stay home if you can, there were other messages that were saying masks are not important, you don't need to wear a mask, you can gather, we need to open up our economy. And so this image is an image of Donald Trump's staffers who are at, this is a Trump rally in October, so we were definitely in the midst of the COVID-19 pandemic, and this is a packed rally, and what you see here is that there are the majority of the people, if not, actually most of the people here at this rally are not wearing masks, and they are literally on top of each other. To the contrary, the president's staff are wearing masks. And so this image really depicts this notion of the politics of public health, in which the individuals who showed up to this rally should have been wearing masks and should have been at a distance to protect themselves, but also prevent the spread of COVID. So what is public health? If I may, see if I can cue this up.
The APHA's 2016 annual meeting in Expo. To get us started, APHA members answer the age-old question, what is public health?
Public health is a vaccine that prevents disease.
Public health is a scientist who discovers the source of a salmonella outbreak.
Public health is outreach that helps prevent tobacco and drug use.
So what is public health? While a doctor treats individuals, public health looks at the health of a community. We research the risk of disease and injury in a population and take action to prevent them before they occur. Our early successes help stop the spread of infectious diseases by improving housing and sanitation. With a greater scientific understanding of health, well-being, and equity, we introduced prevention and early detection activities that helped increase life expectancy by more than 20 years.
Public health is access to prenatal services for healthy babies and moms.
Public health is safety advances like seatbelt laws that have saved millions of lives.
Public health is access to contraception and education to prevent sexually transmitted diseases.
Public health was founded on the principle of social justice. As a basic right, everyone should have the opportunity for good health. But today, improvements in life expectancy have slowed, and we do not live as long as people in many other countries. Did you know? Only a small amount of what affects our health actually happens in the doctor's office. In fact, our health is mostly determined by the social and physical environments in which we live, learn, work, and play. Forget genetic code. A zip code can mean a difference in 15 or more years in life expectancy, even if you live a few miles apart. Nearly half of Americans live in communities with unhealthy levels of air pollution, and the Flint, Michigan lead crisis taught us the dangers of our aging water systems. Poverty and poor health go hand in hand. Too many workers are denied a livable wage. They can't escape poverty and their health suffers. On-time high school graduation is a leading indicator of good health, but more than 20% of students miss this opportunity. Too many neighborhoods lack healthy, affordable food options like fresh fruits and vegetables. Addressing these complex health challenges will require cooperation across many sectors. Thankfully, public health has taken the lead in working with government, community organizations, and businesses.
We partner with city planners to design safe communities that encourage physical activity, bike paths, public transportation, and parks.
We support Medicare, Medicaid, CHIP, and the Affordable Care Act as steps to quality and affordable health care.
We advocate common sense measures to reduce gun violence. We can reduce gun deaths in the same way. We partnered with road planners and car engineers to address auto fatalities.
So what is public health? It is all of us, working together to make sure our communities are safe, prevent disease and injury, and give everyone the opportunity for good health. Join with APHA as we create the healthiest nation in one generation.
I will just summarize the presentation by ending how I started, and that's talking about the field of public health. It is a very abstract field, as I mentioned, and so for those who might be looking for a field that's clearly defined, that's not public health. It is made up of multiple disciplines, all with one common goal, and that is to improve the health of populations. This field has come a long way, and some of the areas that we now focus on, as I mentioned, is not just looking at the population itself, but it's looking at how we address the built environment, the environment in which individuals live, so that we're holistically thinking about the public's health. And then lastly, I'll make the point that the difference between public health in the field of medicine is that as a field, we focus at the population level, whereas the field of medicine focuses on the individual. We seek to prevent the spread of disease and poor health outcomes, again, going way upstream to make sure we are thinking about the risk factors that put people at risk for being exposed to a disease or a condition in the first place. And we work to address those factors, whereas in the field of medicine, the focus is on treatment. This has been a very rewarding career for me, and I am thankful for the opportunity to be a public health professional in this moment in time, and to be in a position to respond, to help protect my community as we deal with the implications of COVID-19, but also the racial injustice that we have all experienced in this moment in time. So with that, I thank you so very much for your time and the opportunity to present, and I look forward to entertaining your questions. Okay, so let's start with the first question. Would you talk about promoting health equity within our own ranks? How can we be the change we seek? What an excellent question. As I started the presentation, I talked about being in that cramped room with other aspiring public health professionals and being told, when you're asked, how much field experience do you have? You respond, I was born in the field. And what that simply means is that in order to address some of our most complicated public health challenges, it's going to take more than book smarts. It's going to take more than what you learn in the classroom. It requires that you show up to this work with your lived experience, acknowledging that your personal lived experience, coupled with the skills and tools and the knowledge that you gain in the classroom, make the perfect combination for being able to bring about significant change. In the context of health equity, and this is a topic that I'm very passionate about, as I shared, in order to be effective at addressing health equity or inequity and promoting health equity, we have to do our part as a nation to change the culture that this country was founded upon. Those ideologies of racism and white supremacy, and I keep saying those words because, one, we are very uncomfortable talking about them in our country, and also we ignore that this is a part of this nation's history and present. And by ignoring that, we further perpetuate inequality and inequities. And so we have to start with fundamentally changing our culture. We also need to diversify those who are at the decision-making tables working to address inequities. And again, how can we be the change we seek? One is acknowledging that you have the power within as an individual to bring about change. And the fact that you even ask the question and you have the desire to do so is the first step. And what you do is you take that desire and that inquiry and you couple that with knowledge, skills, and tools to bring about the change that you want to see in this community. The second question: how would you change the distribution of COVID vaccinations to address the current inequities? And my response to that, I think that the rollout of vaccines is very intentional to address some of the inequities. And so what I would argue is that it's not the priority populations that have been targeted for vaccines first. The issue has been the logistics associated with the rollout. And so many communities across the country are now struggling with a shortage of vaccines. We don't have adequate supply to vaccinate the populations that have been acknowledged as priority in this moment in time. So there's a shortage issue, but then there's also a deficit when it comes to the planning. So for example, one of the things that I'm working on in my community is ensuring that we have a list, comprehensive list of volunteers who reflect the people in the community who will be vaccinated. So we know that seniors right now are being prioritized for vaccines. And in the Black and brown communities, what we're finding is that technology is a barrier. And so when those links go out for people to schedule their appointments for their vaccines, if you don't have access to a computer, or if you're not technologically savvy enough to sign up for yourself, you miss the boat. And so it requires thinking outside the box, thinking about all of the different people in our community, those who don't have the understanding of how to use a computer, those who don't have a computer, those who don't speak English. Do we have proper messaging? Are we able to convey that vaccines are available and where they can go? And so I think the emphasis needs to be placed at this point on the logistics of the rollout of vaccines and the messaging. We still have people in our community who are distrustful of government. And so they say, I'm not getting the vaccine. This is the government's plan for genocide of a community. And we have to acknowledge the distrust and where it comes from, but also work to ensure that there are messages to make to ensure community members feel comfortable getting the vaccine. So we have a lot of work to do on this end in terms of messaging and logistics to make sure it's rolled out in an equitable fashion. The next question, what can I do to improve the health of my community? That's an excellent question, and there are so many things you can do. One of the tools that we have in the field of public health is a community needs assessment. And what that assessment essentially does is allow us as public health professionals to look very closely at a community's needs, but also its assets. So needs may include, you know what, there's no grocery store in my neighborhood. And as a result of there not being a grocery store, people in my community don't have access to fresh fruits and vegetables, something that seems so basic for other neighborhoods. And so as you think about your own community or the community that you want to serve, think about a needs assessment and assessing what are your community needs. Is it, you know what, we need a playground in this community so children can go out and play as opposed to sitting at home on the couch playing video games. We have an obesity issue in this country. The needs assessment could also be, let's look at the sidewalks. Can people actually run in this community? Or are the sidewalks so destroyed that people have to walk in the street or push strollers in the street because they can't use a sidewalk? So I would encourage you to start with looking at what the needs are in your community. But in addition to the needs, looking at the assets in your community. You may already have a neighborhood association or a community group that is meeting to address the needs in your community. And so I encourage you to get connected with those groups so that you can learn about not only the issues and the needs, but what's being done to address them and how you can plug yourself into what's already happening. Or if it's not happening, then you can begin to strategize and think about what you can do to make it happen. The next question, how do you care for your own health as a public health professional? If I could kiss you, I would, whoever sent that question. It is a careful balance. I think about the saying that if you want to go to the best hairstylist in a salon, go to the stylist whose hair is all over his or her head. That person tends to focus so much on everybody else's hair and making sure they look and feel good that they neglect their own. And so I think the same can be applied to other fields like public health. And so what I have learned as someone who is always quick to respond to public health crisis in my community and be on the front lines, that I have to ensure that I'm taking care of myself and my family. And so what I do is I'm very intentional about creating space and time for myself to do the things that I enjoy doing. And that's spending time with family. That might mean cooking a nice, healthy meal, and sometimes not so healthy. It could be, for me, I like to drink wine. I am very intentional about incorporating those things that I enjoy, that bring me happiness into my life. And so I balance my advocacy, my work in the community with doing things like talking to a good friend on the phone, seeing a therapist. Mental health is a big issue in our country, and oftentimes people don't seek mental health specialists. I am very intentional about doing that. So with that, I want to thank you for your questions. Unfortunately, we couldn't get to all of them, but my contact information is and will be provided. Feel free to keep those questions coming. I would be happy to engage with you and answer your questions at a later time. Thank you so much. Be healthy, be safe.